Hello, my name is Dr. Lisa Cleveland, and I'm Associate Professor at UT Health San Antonio School of Nursing. The purpose of our program, www.morenarcanplease.com, is to provide overdose prevention education and access to the life-saving medication Narcan to all Texans in need. Thank you for joining us today for the Texas Targeted Opioid Response, Opioid Overdose Education and Prevention Training. Before we get started, please take just a moment to complete our pre-training survey. You can do this in a couple of ways. First, you can enter our web address, www.morenarcanplease.com, into your browser. Then go to the menu in the upper right-hand corner of your screen. Next, scroll down to Surveys and click on the pre-training survey and answer the items as prompted. Or you can scan this QR code and then follow the steps we just reviewed. If you don't have the QR code app, you can quickly download it for free from your app store. Please pause this video for a couple minutes while you complete and submit your pre-training survey. Thanks so much for completing the pre-training survey. The results of your pre- and post-training surveys will be added to our reports to our funder and will help us receive ongoing funding support so we can continue to provide Narcan to Texas residents free of charge and ultimately save more lives. With that said, the mission of our program is to decrease the adverse impact of opioids on Texas residents through education and access to opioid overdose reversal medication called naloxone or Narcan. The Narcan being supplied through our program and website to Texas organizations and individuals is provided by a federally funded, state-executed grant coordinated by the UT Health San Antonio School of Nursing. Many thanks to all the organizations and folks like our participants today who are being trained. If we can show that our Narcan program is resulting in lives saved in Texas, we can hopefully continue to supply you with free Narcan in the future. So if you use your Narcan and save a life, please be sure to go to www.morenarcanplease.com to anonymously report the life you saved and order your replacement Narcan. Help continue this community effort to stop opioid overdose deaths in Texas. Here's what you can expect today. Following this training, you will be able to explain how opioids work and their differences and similarities, define 3 major risk factors for opioid overdose, recognize the signs of an opioid overdose, respond to an opioid overdose and use Narcan, and describe the law in Texas that allows us to carry Narcan. So let's get started. Overdose death is now the leading cause of injury death for U.S. adults, with 170 Americans dying every day from overdose. Of these overdose deaths, almost 68% involve a prescription or illicit opioid. From 1999 to 2017, nearly 400,000 people died from overdoses involving an opioid, including both prescription and illicit opioids. This rise in opioid overdose deaths is often described as occurring in 3 distinct waves. The first wave began with the increased prescribing of opioid painkillers in the 1990s. Overdose deaths from prescription opioids, both natural and semi-synthetic opioids such as methadone, began to rise and had significantly increased by 1999. The second wave began in 2010 with rapid increases in overdose deaths involving heroin, which resulted from greater regulation and decreased prescribing of opioid pain relievers. As individuals became dependent on prescription opioids and prescribing became more restricted, they unfortunately turned to illicit opioids such as heroin, which can be less expensive and easier to obtain than black market pills in many communities. The third wave began in 2013 with significant increases in overdose deaths involving synthetic opioids, particularly those containing illicitly manufactured fentanyl. This market continues to change, and illicitly manufactured fentanyl can now be found in combination with heroin, counterfeit pills, and stimulants such as cocaine and methamphetamine. So let's talk more about illicitly manufactured fentanyl, since there has been so much media coverage about the risk of exposure. There's a great deal of fear surrounding this drug, and for good reason. It's very powerful and could cause an overdose at much lower doses than prescription opioids or heroin. If you look at the bottles on the right side of this slide, you will see the amount of heroin that might cause an overdose compared to the middle bottle, which is the amount of fentanyl that might cause an overdose. This image really helps to illustrate the potency of fentanyl. Now, the bottle on the far right contains an even more potent opioid called carfentanil, which is used as a large animal tranquilizer for animals such as elephants. As you can see, this drug is even more potent than fentanyl. You can also see the differences in the strength of these drugs by looking at this image of pennies containing doses of both fentanyl and carfentanil that have equal potency. With that said, you can see that opioids are available in differing strengths, but they also can have differing durations in their effect. On this slide, notice how the effects of fentanyl, while strong, may only last about 2 hours. Compare this to the very long-acting methadone, which can be used to treat opioid use disorder. This is another reason it's so important for a person to seek medical attention following a Narcan overdose reversal. It's possible that the effects of the opioid they take could outlast the 30 to 90-minute effect of Narcan, at which time they may again begin to experience respiratory depression. Let's talk a little more about the opioid epidemic. This graphic shows the changes our country has experienced over the past 20 years. The red areas depict regions greatest impacted by opioid-related fatalities, and as you can see, in 1999, only one area in the country was in red. Notice the difference when you compare this to the 2016 map. So how did this happen? The opioid crisis actually began late in the 1990s when pharmaceutical companies convinced prescribers that prescription opioid pain relievers were non-addictive and then aggressively marketed them as effective in relieving both acute and chronic pain. This led to a large increase in prescribing of opioid pain relievers, widespread diversion of these medications, and misuse of them. As a result, opioid overdose deaths began to dramatically increase, which is the first wave of overdose deaths we discussed a few minutes ago. So what is known is that roughly 21 to 29% of individuals who use prescription opioids for chronic pain misuse them, taking more than prescribed. Also, up to 80% of individuals who use heroin first misuse prescription opioids. Further, opioid overdose deaths increased 30% between July of 2016 and September of 2017 in 52 areas of 45 states, and the Midwestern region of the U.S. actually experienced a 70% increase in opioid overdoses during this same time period. It's important to note that there are numerous social determinants that fuel the U.S. demand for pain relief and multiple pathways to opioid dependence. Further, this demand for opioids has created a market for synthetic forms of fentanyl. This demand has also created an underground opioid market that is highly unpredictable in content and potency, something that's unlikely to change. There are a number of risk factors known to contribute to opioid overdose deaths. These include using opioids in combination with other sedatives such as alcohol or benzodiazepines such as Xanax, which can be very dangerous. These combinations can multiply the respiratory depression caused by opioids and contribute to opioid overdose death. Chronic conditions and even aging that can compromise the functioning of organs such as the lungs, liver, and heart can also place individuals at risk for overdose death. This is mainly because they aren't able to as effectively metabolize these medications. Reduced metabolism can lead to greater respiratory depression, a common side effect of opioids. Reduced tolerance after periods of abstinence can also be a risk factor for overdose. This can occur following incarceration or the detox that occurs during inpatient treatment. After a period of abstinence, the individual may not realize their tolerance has decreased, use the same amount of opioid they used before, and experience an overdose. For example, individuals newly released from incarceration have been found to be 40 times more likely to die from an overdose than the general public during the first 2 weeks following their release. Knowing this, many jails have now begun to issue Narcan to individuals with opioid use disorder who are being released from incarceration in an attempt to prevent these deaths. Social isolation is another risk factor. People who use opioids when they're alone are at much greater risk of dying from an overdose since no one else is present to call for help or use Narcan to reverse the overdose. There is a multi-pronged solution to the opioid crisis. First, decreasing the number of opioids being prescribed to the minimum needed after painful procedures such as surgery or dental work is critical. It's also important that we look for other alternatives to pain management. For example, nonsteroidal anti-inflammatories such as Motrin, which can be more effective in managing chronic pain than opioids. Properly disposing of prescription opioids no longer needed is also important. There are many prescription take-back days one can participate in to get rid of unneeded opioids. Inquire about these events in your community. Another solution is access to evidence-based treatment. Fortunately, when talking about opioid use disorder, there are several FDA-approved medications available that can significantly improve recovery success. These medications include methadone, buprenorphine, which also comes in the form of Suboxone and Subutex, or naltrexone, which is also known as Vivitrol. Unfortunately, this isn't true for many other types of substance use disorders. One thing that's important to note, though, is that prescribers should avoid discontinued prescribing of opioids to dependent individuals without ensuring they have access to treatment services. While we want to limit the number of prescription opioids in our community and prevent individuals from developing a problem with them, it's also dangerous and frankly unethical to cut someone off who has become physically dependent without providing access to treatment services. Doing so may force those who have become dependent to look for other and possibly illicit opioid sources, which can increase their risk for overdose. Co-prescribing of the life-saving medication naloxone or Narcan with all prescription opioids is also very important. Many states are now requiring prescribers of opioids to co-prescribe Narcan with every opioid prescription to ensure anyone at risk for overdose, which is truly anyone taking opioids, has access to Narcan. Finally, community-wide access to Narcan is a must. This doesn't mean just law enforcement or EMS, but also friends, family members, and significant others of people who use opioids. So we've mentioned Narcan several times. What exactly is it? Narcan is a life-saving medication. It comes in an injectable form, often referred to by its generic name, which is naloxone. It's now also available as Narcan nasal spray. The Narcan you'll receive by ordering through our website will be the nasal Narcan spray. Narcan can actually reverse an overdose by reversing the respiratory depression that is a side effect of opioids. Narcan essentially pushes opioids off the opioid receptors in the body. It then attaches and remains there for 30 to 90 minutes, not allowing the opioids to reattach, and the individual wakes up. It's kind of like getting the wrong key stuck in a lock. In this graphic, you can see how opioids fit perfectly on the opioid receptors in the brain. When this happens, opioids can relieve pain and cause a sense of euphoria. But if the opioid dose is too high, they can also interfere with the brain's respiratory center, causing inadequate respirations or complete respiratory failure. In this graphic, you can see how Narcan, which has a higher affinity for the opioid receptors than opioids, can displace the opioids off the receptors and reverse their effects. It's important to keep in mind, though, that the effect of Narcan may only last 30 to 90 minutes. Again, that's why it's important for an individual who has experienced an overdose that was reversed with Narcan seeks immediate medical attention following. This is because many forms of opioids have a longer effect than only 30 to 90 minutes, meaning that once the Narcan wears off, the individual may again experience respiratory depression and failure. So just a brief history on Narcan, which is actually on the World Health Organization's list of essential medications. Narcan was developed in 1961 to reverse another side effect of opioids, which is constipation. It was then patented in 1966, and the injectable form was FDA approved for overdose reversal in 1971. In 2008, the initial experiment with community distribution of naloxone occurred with the generic form of Narcan. Pre-filled syringes of injectable naloxone were distributed with atomizers placed on the end, allowing the medication to be administered intranasally. Community-based programs, primarily syringe services programs, began distributing injectable naloxone, resulting in a significant number of overdose reversals among drug users. This demonstrated that non-traditional first responders, lay people such as friends and family members, were more than capable of administering naloxone and saving lives. In 2014, community access to naloxone gained fast-track FDA approval in response to the growing opioid crisis and increasing rates of overdose deaths. Finally, in 2015, Narcan nasal spray, which Texas residents can now order for free from this website, gained fast-track FDA approval to help address the U.S. opioid crisis. This is what the Narcan you order from our website will look like when it comes. Each order will include a box with 2 doses of 4 milligram Narcan nasal spray. This is important since it's always recommended you carry 2 doses of Narcan just in case one isn't enough and you need to re-administer in 2 to 3 minutes. You'll want to protect it as much as possible from extreme temperatures, 40 to 80 degrees Fahrenheit being ideal. So leaving it in a car in the hot Texas summer probably isn't a good idea. The temperature shouldn't affect the strength of the Narcan, but it could cause some evaporation, meaning less Narcan in each dose. Another good reason to always carry 2 doses. Narcan will only reverse the effects of opioids, not other types of drug overdoses. This slide lists some common opioids and includes both fentanyl and illicitly manufactured fentanyl. It's really important to note that if someone is overdosing and you're not sure what they took, and it turns out not to be an opioid, Narcan will not hurt them. It just likely won't help them. Narcan is quite safe and can even be used with children. It has also been used to reverse overdoses involving canine police officers that have inhaled large doses of highly potent opioids. Narcan will not reverse overdoses caused by other types of medications like those listed on this slide, such as alcohol, Valium, cocaine, and methamphetamines. I often get asked why we're able to carry and administer Narcan in Texas without a prescription. In answer to this question, there actually is a statewide standing order that went into effect following the passing of Texas Senate Bill 1462 in 2015. This legislation says that Texans who carry and administer Narcan in good faith in an attempt to save a life are protected from criminal and civil liability, as well as professional disciplinary action for those who are licensed healthcare providers. If you'd like to know more about this legislation, please pause this video and read about it here. While I think it's obvious why it's important for traditional first responders, such as law enforcement, the fire department, and EMS to carry Narcan, what about you? Why should you carry Narcan? There's actually a very good reason. Over the past several decades, more than 250,000 people have experienced an opioid overdose. 77% of these occurred outside of a medical setting. We've mentioned fentanyl several times during this training, and fentanyl definitely has infiltrated our country's illicit drug supply, some areas more so than others. And it has been largely responsible for that third wave of overdoses we discussed. With that said, there have also been a lot of myths and misinformation circulating about this drug. Fentanyl is used all the time for surgical procedures and is actually a very useful drug when used appropriately. And an overdose won't occur from simply being near the drug or even touching it. However, there could be a potential concern if a large amount of this drug was released into the air and an individual inhaled a significant dose. But this scenario really is highly unlikely. If someone comes in contact with fentanyl, they should use the same standard precautions they would use with any potentially hazardous material. First thing you want to do is wash your hands thoroughly. Also, avoid using hand sanitizers since the alcohol in these products can increase the absorption of fentanyl through the skin. Until your hands have been thoroughly washed, keep them away from your mouth, nose, and eyes to prevent absorption through these vascular tissues. If someone's clothes have become contaminated, they will want to follow their department or agency guidelines that likely include careful removal and laundering. Let's talk about the underlying physiology of overdose and how it occurs. First, when an individual has taken too high a dose of opioids, the respiratory center in the brain can begin to shut down. Their breathing significantly slows, and ventilation may become inadequate. Over time, their breathing stops, depriving their vital organs, such as the brain and heart, of needed oxygen. As the heart is deprived of oxygen, its ability to pump blood to vital organs is affected. Circulation of blood ceases and tissue death occurs. What is the cure for an overdose? It's oxygen. An individual can be helped for a while with respiratory support through rescue breathing and supplemental oxygen. But to truly reverse an opioid overdose, Narcan is needed. So now that you're carrying Narcan, what do you do if you come upon a person experiencing an overdose? There are a couple of easy steps we'll review that you can follow. First, tap the person's shoulder and try to get their attention. You can say, "Hey, are you all right?" or firmly yet gently rub your knuckles up and down their breastbone to try to wake them up. If they respond but still don't seem quite all right, call 911. Place the person in the rescue position on their side and remain with them until help arrives. If, on the other hand, there's no response after a few seconds, don't wait any longer. Remember, every second counts when someone's not breathing. Call 911 and take action while you're waiting for them to arrive. Then, and this is the most important step, grab your Narcan. Open the box and take out one of the 2 nose sprays and peel it open. Insert it into the person's nostril all the way until your finger touches the edge of their nostril. Once you've done that, press the plunger and release the entire dose. Remember, the nasal mucosa is very vascular and will readily absorb the Narcan. The person doesn't have to be breathing for the Narcan to work. Next, roll the person on their side while waiting 2 to 3 minutes for the Narcan to take effect. If you're trained in basic life support and feel comfortable doing it, you can also provide rescue breathing for the person while you wait. Keep in mind when they wake up, they may be very disoriented and frightened. Also, if they're opioid dependent, the Narcan may put them into withdrawal, which is not life-threatening but can be very unpleasant. They may feel really sick and not be happy with you, but that's okay. They're alive. If 2 to 3 minutes pass and this person still has not woken up, you can deliver another dose of Narcan in the other nostril and continue rescue breathing. In rare circumstances, it may be necessary to deliver a 3rd dose if the person still has not awakened 3 to 4 minutes after the 2nd dose, but hopefully by that time, help will have arrived. Every second of response time matters when someone's not breathing. Opioid-induced respiratory depression can lead to permanent brain damage in as little as 4 minutes, and death can occur in as little as 4 to 6 minutes. Consider this and the fact that the U.S. national average EMS response takes about 7 minutes, meaning that the time from calling 911 to help arriving can take up to 7 minutes. For individuals living in a rural setting, this response time can be up to 14 minutes. So again, when someone isn't breathing, every second matters. Also, consider that 80% of overdose reversals are not performed by EMS or law enforcement. They're done by people just like you who may be community members, peers, or family members of someone in need of help. Further, half to 2/3 of heroin users have experienced at least one non-fatal overdose. And once someone has experienced an overdose, it's much more likely to happen again. And 80% of people who use drugs have observed an overdose. This is just one more reason why we should all carry Narcan. Thank you again for your interest in this training, which may result in lives saved. Please feel free to reach out to myself or members of our team if you have additional questions. Also, remember, if you use your Narcan, please report your outcomes. This information is so valuable in helping us make sure we can continue providing this free Narcan for all Texans. And at the same time, you can order your replacement dose for free right here on our website. Now, please take just a couple seconds to complete our post-training survey. Again, any information and outcomes we can report back to our funders helps ensure we can continue doing this work for Texans. Click the Surveys tab again on our website, but this time please take the post-survey to help us understand if this training has met your needs. Go to our web address, www.morenarcanplease.com, then go to the menu in the upper right-hand corner of your screen. Next, scroll down to Surveys and click on Post-Training Survey and answer the items as prompted. Or you can scan the QR code and then follow the same steps. Once again, thank you so much for joining us for this training today and for helping us to save lives in Texas.